Yes.
Yes, yes.
Yes. Okay. So, dear doctors and attendees, I'm Dr. Indranil Bavdekar. Today, I welcome you all on the occasion of 1862 for continuous webinars by IFPH. Before starting the webinar, we'll have only a 1 minute silence. So, I request all to just have a silence for 1 minute. Thank you. Yeah. For the newcomers who have joined, just a few words about the IFPH. So, doctors, the International Forum for Promoting Homeopathy, this is an international forum which is basically formed to promote homeopathy and its activities worldwide under one umbrella. Daily, we have 3 speakers in different languages, that is Hindi, English, and Malayalam. Continuously, the webinar has been conducted with the efforts of all the team of our IFPH. Witnessing the present day of the world, we humbly request that we should tell everyone and should know that the homeopathic medicines are very less expensive and they are very helpful in day-to-day in very difficult diseases which we are witnessing. To fulfill our objectives, like we should promote homeopathy, and also we can get introduced to all the speakers which are across the globe, and we all are helping our colleagues to get introduced to different topics. So friends, I humbly request everyone that there is a YouTube channel of IFPH. Every second or third day, these webinars are uploaded on it. So kindly subscribe for the channel. Also, for the attendees, I will request that kindly join with your videos so that we can know you. Now, about the today's speaker. Well, we are very happy to have a second part of our today's speaker. First part was also very interesting, which I have attended. So today is our guest is Dr. Pratiksha Rajendra RATADIYA Madam. Madam is MD in Homeopathy. She is B.H.M.S, C.G.O, C.C.H, NTET passed, and she is an assistant professor in the Department of Homeopathic Repertory in Lokmanya of Medical College, Pune, that is located in Maharashtra. She is the founder of Sanjeevan Homeopathic Clinic, Pune, Maharashtra. Also, Madam has presented paper on Homeo World Vision 2025, which was organized by Indian Institute of Homeopathic Physicians. The topic for her paper presentation was about Abroma augusti, an alternative for treating primary dysmenorrhea. This was a very nice topic because the drug usually is used only for diabetes, correct, but some different uses there. So it's was a really very nice topic. Some of her articles have also been published in Homeopathic 360 platform. She has an experience of more than 6 years and also 2 years in the teaching. Friends, today her topic to speak with us is General Clinical Examination and related rubrics in Kent's Repertory. This is a very important topic for us because Kent's Repertory, so also many times we miss many rubrics. So Madam will be highlighting on this. So I request Madam on this part of IFPH to kindly take over the charge and begin with her lecture by sharing her screen. Welcome, Madam.
Thank you, Indrani, and good evening, everyone. So without wasting much time, I would like to just share my PPT over here. Yes, so good evening, everyone. And thank you, Dr. Indranil, for introducing me. So myself, Dr. Pratiksha, and I, as Sir said, I have my own clinic at Pune, Maharashtra. And before starting the session, I will like to be or express gratitude towards my parents, teachers, and IFPH for giving me this opportunity to present my second part of my webinar here today. And I would also like to thank Dr. Dhanesh for, constantly being in touch and giving this opportunity. So my today's topic is general clinical examination and related rubrics in Kent's Repertory. This is the second part of the session, which we had previously conducted in the month of September. So for those practitioners who were not able to attend my webinar last time, for them, I will just like to have a quick recap of whatever we had discussed in the introduction part. So as we all know about history of homeopathy and origin of homeopathy. So origin of homeopathy was by Dr. Samuel Hahnemann, and Dr. Samuel Hahnemann, because he was not convinced with the method of treatment present during that time in the old school of medicine, led to the Cinchona bark experiment, and then obviously laid the foundation stone for homeopathy. After that, Dr. James Tyler Kent, as we know, he has also been an old school physician initially. And after that, due to his wife's treatment for insomnia given by some other renowned homeopath during that time. So due to impressed by the treatment given to his wife for insomnia, Dr. Kent also eventually got it converted into homeopathy. So my point behind saying this point of Dr. Kent being converted to homeopathy is that before being converted to homeopathy, Dr. Kent was a very good clinical physician. So we always, whenever we talk of Kent's repertory, usually all of the physicians have in mind that mind section or mentals is the only thing why we should refer Kent's repertory. But according to me, Dr. Kent, other than, obviously mind section is important, but other than mind section, Dr. Kent has given a lot of emphasis on clinical rubrics as well, or what we call as objective rubrics. This word was actually, I got to know in the last webinar by doctors present over our platform over here. So they helped me to know that there are two kinds of such rubrics, subjective and objective. And yes, this is the right word, that is objective rubrics is what I want to highlight. So before starting to that, let me just give a quick information about clinical examination books. So Hutchinson's Clinical Methods and P.J. Mehta's Practical Medicine is are the two books which I usually refer for clinical examination. Other than that, for studying the medicinal part, I can say Davidson's book and Harrison's book, obviously, are two good books relating to proper medical part. Okay. And these are the books which I have just taken some pictures from the internet for all of us. Then, how do we study a case for finding a simillimum in homeopathy? So this is what I would like to start with. So how do we finding a simillimum in homeopathy? First is by proper case taking. This is the first step. Then second comes proper general examination of the patient. And the last point which comes is proper systemic examination. So according to me, I feel these three are the very vital points which lay the foundation stone for whatever simillimum we are going to give the patient. And here, proper case taking. Now, what does this include? Chief complaints should be complete in LSMC format, which all of us know, that is location, sensation, modality, and concomitants if present any. Okay. Then we should ask about the associated complaints is the next step, if any associated complaint is present. Then next thing is we should always go into details of the case taking and ask for ODP ailments from which are very vital for selecting any simillimum. Then obviously inquiring into past history, family history are equally important, through which we will get a hint about what miasmatic background the patient is having. Then next comes personal history, and that personal history should be asked for because it will give us few insights into the physical general or generalities which are very important for individualization. Then next is mind and mental state should also be studied. But remember, I have purposefully written mind and mental state at the end because nowadays we just go on focusing that and we lose all the clinical part behind taking a case. We should always keep in mind that the patient comes to us first because we are going to diagnose him, check him, and give him a proper amount of satisfaction along with the points which are useful for diagnosing according to medical profession also. So this was my first point of proper case taking. Next point is proper general examination. So my first part of the webinar was on this particular topic of proper general examination. For the people, for the doctors who are new over here, who are attending my session for the first time, they can go over on 13th September over the YouTube channel and can look. I have in detail explained each and every point of general examination. Now, today what I want to speak is regarding continuation of this general examination and moving forward towards the systemic examination. So whenever we think of systemic examination, mostly these four systems are the systems which the patient comes to us with maximum number of times. They have complaints from these four systems. That is gastrointestinal system, respiratory system, cardiovascular system, and central nervous system. Most of the problems the patient come to us with these these four particular systems. So let me start with gastrointestinal system examination. So whenever we think of examining a particular system, these are the 4 points which are important for examination. First is inspection, then is palpation, percussion, and auscultation. So inspection is basically just observing the patient without touching the patient. Palpation means we apply a little bit pressure and check the patient by touching it. Percussion is also relating to touch. And auscultation means we auscult with the help of stethoscope. And in relation to gastrointestinal system, it is specifically done for hearing the peristaltic movements. So starting with inspection. Now, as I mentioned before, inspection relates to observing the patient. So shape of the abdomen should be examined or observed, I mean. Then umbilicus, abdominal movements, pulsations, dilated veins, if any present, should be looked for. And peristalsis. Peristalsis, if it is visible, fine. Otherwise, peristalsis can also be heard during auscultation. Okay. So coming to our first point of observation or inspection. So shape of the abdomen should be looked for. Now, what do we observe during that? In normal persons, the shape of abdomen is scaphoid or boat shaped in any normal individual. But now there are two variations to this, and one of the variation is distension of abdomen. So variation like distension of abdomen can occur due to presence of fat, which we call as obesity. It can be present, distension can be present because of fluid, which we call as ascites. Next is because of feces, that is stool. Then there is flatus. Then next, the reason for distension can also be presence of fetus. This is for pregnancy cases. Then fullness of urinary bladder. This can also be the reason of distension of abdomen whenever a patient is lying in front of us. And one of the last points is fatal new growth. That is any overgrowth inside the abdomen. Okay. Next point which comes as abdomen in cases of also abdomen can appear sunken in cases of starvation and malignancy. Okay. Now next is shape of the abdomen. Now how will this shape of the abdomen appear? So shape of the abdomen. Are you able to see my screen?
Yeah, we are able to see the screen, no problem.
Okay, just a second.
It is visible, madam, no problem.
Yeah. I'm sorry, I wasn't able to see my screen myself. Okay. So shape of the abdomen. So here I have shown distended abdomen at one side. This is one of the photographs which I have taken from internet. And here you can see that distended abdomen, most probably the cause might be ascites. So you can see how the abdomen is distended, enlarged, and the umbilicus also, if you can see, it is affected. Then the next picture is of sunken abdomen. So here for sunken abdomen, you can see there is absolute no mass left for any kind of fat in the abdominal space. Okay. And this usually occurs in starvation. Then just a minute, sir. Actually, I am not able to continue with the slide.
You can press enter or the right side. You can just move. Slide is visible.
Yeah, but I am not able to.
I'll tell you, sometimes it get hangs, madam. You can again unshare and again reshare your screen. Probably this will solve the problem. And you can go to this slide again. See if you can.
Yeah.
Okay.
Now are you able to see?
Yeah. We are able to see.
Yeah, I guess it was hanged.
Yeah.
Okay, thank you, sir, for helping me out. So this is what I was talking about, sunken abdomen. So now what are the rubrics relating to such clinical observation into the Kent's repertory? So under abdomen chapter, page number 544 to 546, we will find a lot of rubrics relating to distension of the abdomen. And let me start with distension. Then sub rubrics come as distension in the morning. Distension in the morning, fasting while. So if some patient complains like the patient भूखे रहने से अगर पेट फूल जाता है, so this can also be one of the single remedy rubrics given. Then distension morning, waking on. Then distension in the forenoon, distension in the noon, then distension in the afternoon. Okay, distension in the afternoon after eating, single remedy rubric bryonia. Then distension in the afternoon 4 p.m., single remedy rubric lycopodium. Then next slide, I would like to just grab your attention. Here we have under same abdomen chapter continued distension as the rubric. Sub rubric is evening. Then we have a lot of sub rubrics, sub rubrics also. Distension in the evening, lying while. Distension at in the evening 6 p.m., 7 p.m. So these are the observations which respected Dr. Kent himself has given, and I think this is the most authentic book because new age, new remedies keep on updating. But as this is one of the oldest information, I guess we can short 100% relay on such information. Then next is distension night, then distension midnight, distension midnight after. So there are a lot of sub rubrics. Then if you can see, there is one of the rubrics as distension children in. Here we have Brita, carp, calcarea, causticum, and sulfur, which are given as 3-mark remedies. Okay, and then we have distension, constipation during. So these are also some of the things which usually our patients complain of. When I'm constipated, there is distension of the abdomen, or we can even see that. Okay, so these all are the sub rubrics. If you respected practitioners, if you want, you can just take a screenshot of the rubrics so present over here. Then next is same distension, epileptic attack before. Distension, eructations, ameliorate. Distension, flatus, ameliorate. So a lot of sub rubrics you can see over here. So one more important, a few important I'll mark. Distension, mothers in. So a lot of mothers come and tell us that after my parturition or after the child is born, I have accumulated a lot of fat. So this is also useful. The next is distension stool before, distension stool during, after, distension stool ameliorate. So these are some important points. Then is distension urination before, distension walking in open air. So these are the few rubrics relating to distension. Then we have distension of specific quadrants of the abdomen also. So all of us must be well aware that there are 9 quadrants of the abdomen, and then we can, according to the region given, we can always find distension if there is in any particular area. Okay, so here you can find hypochondria distension, hypogastrium distension, ileocecal region, inguinal region distension, distension of the sides, distension umbilical region of. So all these are the sub rubrics. Okay. Next is under abdomen chapter. Now one was distension, the other was sunken abdomen. For sunken abdomen, in Kent's repertory, we have only one rubric, which at least I think is important because it is single remedy rubric. Emaciation of muscles of abdomen, and plumbum is the only medicine which Dr. Kent has suggested us. Then next we come to the point of inspection, that is umbilicus. So how can umbilicus appear? Normal umbilicus is inverted. Okay. Then if there is ascites is present, the umbilicus is transversely stretched or smiling or flattened or everted. Further, I have pictures of those, but just I would like to explain this slide. In obesity, how it will appear. So the umbilical cleft, which is seen, appears to be deeper than in a normal umbilicus, okay? And everted during herniation or hernia cases, how do we find it? Is everted umbilicus may occur in herniation of bowel or fat into wider umbilical ring. So here I have taken two pictures. One is pot belly and smiling umbilicus, and second picture is of everted umbilicus, which is seen in cases of herniation. Okay, so these are the two pictures. First, smiling umbilicus, we can very well see it in cases of ascites also, and second is herniation. Now, how do we find it? So we find under abdomen chapter, page number 600, we find retraction sensation of, and if we want it as particular for umbilicus, we can find retraction of umbilicus. And for our umbilicus also, we have in the morning, lying while, sitting, stool before, stooping on. So these are sub-rubrics under umbilicus. Okay. Now my next point is regarding abdominal movements. If any abdominal movements are visible during inspection of gastrointestinal system. So straight afterwards, what are the abdominal movements which Dr. Kent has given into the repertory? So under abdomen chapter, once again, on page number 554, we can find abdomen chapter movements in. So the movements is the rubric, and under that we have a lot of medicines along with sub rubrics. So movements in the morning. Okay, movements of abdomen in the morning. In the morning also they have given while the patient is in bed. Natron carb is the only medicine given. Then movements in the morning on waking. So we have a different medicine where as the patient gets up in the morning, there is some movement felt. So there is RUBRICS is what they have given. Okay, and movements of abdomen during forenoon, stool before, then we have an afternoon, 1 p.m. Then we have movements in during evening, during night, after breakfast if there is abdominal movements felt, then dinner after, eating while. Okay, so there are a lot of such sub rubrics given on page number 554. Then we have, again, as I mentioned above, we have particular regions where the movements can be seen. That is hypochondria, hypogastrium. In hypogastrium, movements after dinner and after stool. Okay. And then we have inguinal region, sides, umbilical region. So all these are important rubrics relating to movements of abdomen. Then next point which comes is pulsations. Now, normally, if we see, pulsations are not visible over the abdomen in any normal person, but pulsations may be visible in a few conditions, like when after eating, there is increased blood flow towards the abdomen. So, main reason behind pulsation is there is increased blood flow towards a particular organ. And so the pulsations are felt. So after eating, obviously it will increase blood flow. Then during pregnancy also, the blood flow is increased. If the patient is lying down, is in a lying down position and has raised the knees or legs, then also these pulsations can be seen in a few patients. And one of the important reasons is abdominal aortic aneurysms, which is a very important reason if pulsations are very severe in occurrence and very frequent in occurrence. Okay. So where do we find pulsations into the Kent's repertory? So under abdomen chapter, page number 599, pulsations we can find as a main rubric given, and under that we have pulsations in the morning, evening, night while laying. So if you can see, while laying at night, if the pulsations are there, aloes is the only remedy which is given. So such was the depth how Dr. Kent studied his patients. Then Next is pulsations after eating. So this is one of the reasons which I mentioned previously also. What is the reason behind increased pulsations? That pulsations heat during. Kali carb is the just one single remedy rubric. Then we have pulsations lying while, pulsations menses during, pulsations stool after, pulsations supper after. So these are some of the sub rubrics. Okay. Then according to regions also we have a set of sub rubrics and remedies given. That is hypochondria, hypogastrium, inguinal region, sides, umbilicus. So these are the places where we can feel or we can see the pulsations, or the patient can feel those pulsations. Okay. So next point is dilated veins. So where do these dilated veins, or what do they indicate, and what happens exactly uh, if dilated abdominal veins are seen? So it is believed usually we do not see any dilated veins, but if this is a pictorial format, what I have taken from internet sources for all of you to please that how a normal abdomen appears. If there is dilated veins present and the blood flow is from below to upwards, below to down, upwards, we can see the veins, then what it indicates? It indicates inferior vena cava obstruction. If it is from above downwards, it indicates superior vena cava obstruction. And if it is generalized, it is superior vena cava obstruction and along with the azygous channel. So all these are some of the conditions where dilated veins can be seen. But important reasons can be veins. Now, where do we find this into the Kent's repertory? So under abdomen chapter on page 605, we will find veins distended, and we have just two remedies, that is berberis and sepia. Veins distended varicose. So we'll find only two remedies, that is hemamylase and sulfur. And veins distended in inguinal region. I want all of you to please pay attention. That is berberis is the only single remedy rubric given for veins distended in inguinal region. Next point is peristalsis. So what do we? Peristalsis is the involuntary contraction and relaxation of the longitudinal and circular muscles throughout the digestive tract, allowing for the propulsion of contents beginning in the pharynx and ending in the anus. So what causes the forward movement or propulsion of the contents from pharynx to anus? That movement is peristalsis. And where do we find now these peristalsis into the repertory? Now let me tell you why will we need this peristalsis movement. We will need this peristalsis movement in cases where there is indigestion causing the patient to be a little anxious for health. And so Dr. Kent into his repertory has given reference of peristalsis into abdomen chapter, page number 599, under peristalsis reversed as one of the important rubrics, and there is asafoetida given as important remedy into this peristalsis reversed. So peristalsis reversed is what? Peristalsis is from upward, that is from pharynx to anus, the waves should go or the propulsion should occur. But if it is happening ulta, that is from downwards, it is going above. So the medicine given is asafoetida, that is hing, what we call it in Hindi. So if all of us are aware, hing is very useful for digestion according to Ayurveda as well. And next medicine is given, that is elapse. Okay. Next point is herniation. So is any herniation visible? So common types of hernia. What are the common types of hernia that we find? First is umbilical hernia. So I have just taken a picture for all of us to go through. That is umbilical hernia, inguinal hernia, and femoral hernia. So these three are the basic types what we see. Okay. Among that, where do we find it into Kent's repertory is under abdomen chapter, page 552. Hernia femoral, we get direct rubric, and we have just two medicines, that is lycopodium and nux vomica. Then next we have hernia, sub-rubric is inguinal. So we have a set of medicines. Now inguinal hernia, if it is strangulated. So actually people nowadays don't just rely on homeopathic medicines for hernia, especially if it is strangulated, if the herniation is painful. But Dr. Kent has given a set of medicines, and I'm sure only and only after verifying into his clinical practice, he must have mentioned these medicines. So we have hernia inguinal painful, hernia inguinal children in. So we have just 4 remedies given by Dr. Hahnemann in children. So that is aurum, nitric acid, and single first grade medicines, that is lycopodium and nux vomica. According to sides also in children, if it is right sided, left sided, we have different medicines. Then if we have inguinal inflammation, also medicines are different. Umbilical hernia, if it is present, we have medicines like nux vomica, calcarea, lachesis, nux mosciata, and opium. Okay, so I want all of you to please go through this slide also. Next is palpation. Now, palpation plays an important role for diagnosing the area which is affected, especially in gastrointestinal system. According to different vital organs present, liver, spleen, kidneys, gallbladder, these are the organs which we usually palpate for while checking a particular patient. Straight are we going towards what do we find during palpation is if the abdomen is enlarged. So we have rubric for it under abdomen chapter, page number 546, that is abdomen enlarged as the rubric, and abdomen enlarged children in. So we have a set of medicines given. Then we have abdomen enlarged children who are having marasmus. So this also we see pot belliedness of the abdomen in cases of marasmus. Then abdomen enlarged because of fat. So we have only 2 medicines. That's ammonium mure and calcarea. And then if the abdomen is enlarged in mothers, we have just 3 medicines given by Dr. Kent. That is iodum, natrum car, and sepia. Next is if liver is enlarged. Okay, so if there is enlargement of liver, which we call as hepatomegaly, so if we find this, then we have a set of medicines. There also, if specifically left lobe is enlarged, magmure is the medicine. Then if we have next rubric as enlarged liver, anger after, so we have cocculus as just single remedy rubric. Liver enlarged children in, so we have just 2 medicines given. Okay. Then mesenterics, if they are enlarged, if spleen is enlarged, we have different medicines given according to the organ which is enlarged. Okay. I'm really sorry if there is a disturbance in noise because as today there is the Sharad Purnima going on, celebrations going on. So might be in my background, some noise can be heard. Okay. Next, what we palpate is under abdomen chapter, lump in abdomen. So if there is some kind of lump which we can palpate in abdomen or lump sensation, if this is felt by the patient, we have a set of medicines. If there is lump in the liver region, there is just single remedy, that is tabacum. Next, if there is lump in abdomen, in spleen area, we have just single medicine, that is sulfur. If we have lump in abdomen, in umbilical area or umbilicus, spigelia is just one of the medicines. Okay. So moving to next, I would like you all to now direct towards specific organs and where they have been mentioned by Dr. Kent into the repertory. So liver is one of the vital organs relating to gastrointestinal system, and Dr. Kent has given its reference in abdomen chapter, page 553, liver and region of. So this is one of the direct rubrics given or what we find into the abdomen chapter, liver and region of, and we have a lot of medicines that have been given. Next rubric that we have is fatty degeneration of liver. So this is given in abdomen chapter on page 547. So this fatty degeneration of liver or fatty liver, what we call, we have a lot of patients coming nowadays to us with this particular concern of being diagnosed with fatty liver after doing some USG as a routine checkup. And most of the patients are concerned and have, obviously they have other symptoms also, especially relating to some kind of hyperacidity. So we have fatty degeneration of liver, and there we have a few medicines. Merc and phosphorus are one of the important medicines which have been given over here. Then next rubric relating to liver present in the abdomen chapter is cirrhosis of liver. So cirrhosis of liver, cuprum, hepar, then phosphorus, muriatic acid, sulfur are the medicines which have been given for specifically for cirrhosis of liver by Dr. Kent. Next rubric relating to liver present in the abdomen chapter is on page number 541, that is atrophy of liver. So atrophy of liver, we have a set of medicines given by Dr. K. Next vital organ is spleen. So for talking about spleen, where do we find the reference of spleen into the Kent's repertory? So we find as in abdomen chapter, page 602, we find spleen complaints of. So this is a direct rubric given, spleen complaints of. Okay. So after that, I will just move towards the next vital organ, that is gallbladder. So gallbladder is where it is mentioned in Kent's repertory. So one of the important point I would like to tell over here is gallbladder as a direct organ has not been mentioned into the Kent's repertory, but its reference we can find as gallstones. So gallstones also, I'm really sorry, I forgot to just add one more slide in front of gallbladder, and that slide I will just tell you orally that complaints relating to gallbladder, especially gallstones, we can find under the chapter of pain into the abdomen chapter. Okay, in abdomen chapter we can find it under the rubric of pain, and under pain we will find it as pain liver. Okay, and after pain liver, the sub rubrics which comes is colic, and after colic a small comma has been given and gallstones has been written. So just this reference we can find in relation to gallbladder. Otherwise, direct gallbladder rubrics are very rare into the Kent's repertory. Next important organ is kidneys. And an entire chapter is given in Kent's repertory relating to kidneys. So if we get a chance to present a webinar somewhere in the next year, so I will definitely coming year, I'll definitely like to present the webinar over this kidneys chapter. Next is we look for tenderness. Whenever we talk of palpation, we palpate and we look for tenderness. Tenderness is pain on pressure. So it is commonly found in inflammatory lesions of the viscera, that is organs, and the surrounding peritoneum. So for tenderness, Dr. Kent has again given us a few rubrics. So as we have seen, tenderness indicates inflammation of the viscera or inflammation of the organs. So where do we find it into the repertory is under abdomen chapter, page number 552, we find inflammation as an important rubric given. And if you can see or differentiate, they have given into brackets as peritonitis, enteritis, etc. Then moving further, we have inflammation, appendicitis. So we have a set of medicines given for appendicitis inflammation also. Although for most of the cases of acute appendicitis, there is an emergency, and obviously we should see to it whether we can handle this, or we do have to refer or take advise the patient to visit the allopathic treatment. Okay. Next is under abdomen chapter, we find inflammation of inguinal glands. Then inflammation of liver, that also we find. Inflammation of liver, mortification after. So as we know, lycopodium is an important medicine when we talk of liver complaints. Nux vomica is an important medicine when we talk of liver complaints and liver enzymes. And so after mortification, if the liver is inflamed or complaints relating to liver are occurring, lycopodium is a single medicine given. Then inflammation of liver, vexation after. So here also chamomilla is a single medicine which is given. Now, in cases of pancreatitis, if the patient is having some problem with the pancreas, inflammation of pancreas, we have a set of medicines given by Dr. K. Spleen, inflammation of spleen. So all these inflammation of umbilicus, okay, all these are the medicines which are given by Dr. Kent into the abdomen chapter of Kent's repertory. Next, when we talk of continuing with the systemic examination, when we do percussion, so what do we mean by percussion? Uniform enlargement of the abdomen may be because of gas or fluid in the abdomen. So if the abdomen is enlarged, distended, it can be because of two reasons. One is because of gas, accumulation of gas, or because of accumulation of fluid. If the enlargement of abdomen is due to gas, so while percussing, there is a tympanic note which is felt on percussion. And if the enlargement of abdomen is due to presence of some fluid, while percussing, we will hear a dull note. Okay. So here, now when we talk about distension, we always talk about either gas or fluid. And if we talk of fluid, it is definitely one of the important condition is ascites. And if we all remember, or especially I remember last time Dr. Indranil had asked me where is ascites given into the Kent's repertory, and coincidentally during this session I am able to show everyone that under abdomen chapter, page 546, dropsy has been given, and in front of dropsy they have written ascites as a rubric. So dropsy as a main rubric and ascites as a sub-rubric has been given, where in cases of ascites, we can treat the patient with the following sets of medicines. Now, if dropsy or ascites is present with chronic diarrhea, medicines will differ. Induration of liver if is present along with dropsy, medicines will differ. Then if due to or after abuse of quinine, the complaints are there of dropsy, that is quinine is what we call as China. And then suffocation lying, if there is suffocation lying on the left side during dropsy, we have EPIS as the medicine. And if dropsy is present along with edema, medicines differ. Okay. So next thing which is present for percussion is abscesses in walls. So abscess is also one of the important thing which I will like to mention when we'll talk of accumulation of fluid. So if abscess is present in the walls, we have a set of medicines in abdomen chapter. If abscess is in the inguinal region, we have a set of medicines. If abscess is present in liver, so on USG we'll find all these findings. If abscess is present into spleen, we have a single remedy medicine. Okay. Next, now moving towards the next system, that is respiratory system, usually people complain of these complaints which I have shown into the slide, that is breathlessness, cough, sputum, hemoptysis, wheezing, and pain in chest. These are a set of complaints which usually people complain and which point towards something or some problem in the respiratory system. So now moving towards pleural effusion, one of the important disease condition which I would like to grab all of your attention is for pleural effusion. That is, what do you mean by pleural effusion? That is accumulation of fluid in between the pleura and the lungs. So all of you, if you are able to see the picture, what I have tried to show over here, one side it is a normal lung and the other side there is pleural effusion. Okay. And now, where do we find this into the Kent's repertory? So if we have any cases of pleural effusion, how do we find it into the Kent's repertory is under chest chapter, page number 829. We will find dropsy as a rubric. And under dropsy, we have a few other rubrics. So dropsy means accumulation, edema, swelling. Okay. So dropsy, asthma with, dropsy, disease with organic. Disease side can lie only on affected side. Okay. Can lie only on right side with head low. So here there are a few specific sub rubrics given. If the patient gives us such modalities, we can definitely think of these medicines. Then next clinical condition relating to respiratory system is emphysema. Now, what does emphysema mean? So emphysema is enlargement of alveoli of the lungs with loss of pulmonary elasticity. So we all know that during inspiration and expiration, there is this elasticity of the alveoli which is responsible for proper respiration. But in cases or diseases like COPD, chronic obstructive pulmonary disease. One of the important disease under COPD is emphysema. And in emphysema, what happens, which we usually see into people who are into habits of chronic smoking, what we see is enlargement of alveoli is there, but the person is not able to breathe properly. There is no elasticity present. Okay. So where do we find it into the repertory? Under chest chapter, we have a direct rubric of emphysema given by Dr. Dr. Kent on page number 829. And we have a set of medicines also given over there. Next disease condition, what we find is empyema. So empyema is an important disease condition which we can see into our practice, and this occurs because of accumulation of pus into the pleural cavity. So pleural effusion and empyema are almost similar conditions, and this thing, if we have to find into the Kent's repertory, we have a direct rubric given, and that is under chest chapter, page number 830, we have empyema as a direct rubric given into the Kent's repertory. And we have a set of medicines also for that empyema disease condition. But as I always say, just considering the clinical rubrics is not enough for giving the simillimum, but these can shorten our search for the simillimum. Next is pulmonary edema. So for pulmonary edema, what actually happens, this is a pictorial format what I have taken for all of you. Here, pulmonary, on one side, there is healthy alveoli seen. In healthy alveoli, there is no fluid buildup into the lungs. If you can see the picture. So on the right lung, there is no fluid buildup and the lung is healthy. But on the left lung, there is unhealthy alveoli present and there is fluid buildup into the alveoli, which is leading to pulmonary edema. Okay. And how do we find this into the Kent's repertory? So into Kent's repertory, we find it as under chest chapter on page number 838, we find it as pulmonary edema, and pulmonary edema sub rubric we have pulmonary edema, pulmonary drunkards in. Okay. So here there are two sub rubrics given for edema pulmonary or pulmonary edema. Okay. Next we will go towards another disease condition which we see in the respiratory system, and that is pneumonia. So pneumonia is a common condition which many people suffer, and stages of pneumonia, this I have taken a picture. That is, first stage is congestion, stage of congestion. Then second stage is red hepatization. Then third stage is gray hepatization, and then the last stage is stage of resolution. And these stages, they require or they change from first 24 hours to 1 to 2 weeks. 1 to 2 weeks is the time required for last stage to appear, that is stage of resolution. So where do we find it into the Kent's repertory? So we find it into chest chapter on page number 834. We find it into hepatization of lungs. So this is what I wanted to say when we talk of stage 2 and stage 3. So Dr. Kent has given its reference into the repertory as hepatization of lungs. So this is an indication for us to treat cases of pneumonia. And then we have hepatization of lungs, right. So if right lung is affected because of pneumonia, what are the medicines? So under that also we have, according to lobes, we have upper right half of the lungs is affected. Due to pneumonia, we have just single remedy rubric, that is chelidonium. Then hepatization of lungs, if it occurs on the left side, we have a set of medicines given. Then hepatization, that is pneumonia, if it occurs and lying on the right side aggravates the patient's complaints. Let it be cough, let it be pain in chest or breathlessness or whatever. So we have two medicines given by Dr. Kent. Then lying on right side, if that thing ameliorates in pneumonia, then we have a single medicine phosphorus given by Dr. Kent. Then lying on right side, lying on left side, if it aggravates, it is phosphorus as the medicine. And lying on back, if it aggravates, again phosphorus is the medicine. So phosphorus is one of the important medicines according to Dr. Kent for pneumonia cases in as per given in chest chapter. Next disease condition which we see, that is bronchitis. So bronchitis means there is some problem with the bronchial tube and there is accumulation of thick mucus into the bronchial tubes. And if you are able to differentiate, all of the doctors, if you are able to differentiate, the right lung is unaffected. On the left side, you can see there is this inflammation of the bronchial tubes leading to accumulation of mucus. So where do we find it into the Kent's repertory now? Into Kent's repertory, we will find it as into chest chapter, page number 835, we will find inflammation bronchial tubes. And in the brackets, if you are able to see, it is given as bronchitis. We have a lot of medicines given, which are 3 mark, 2 mark, and single mark also. After that,
Madam,
below
sorry
it,
to
we will
interrupt.
find.
Only 5 minutes. Sorry to interrupt you. Only 5 minutes are remaining. Yeah.
Yes, sir, sure. We are just going to end soon. Yeah.
Yeah.
So next is inflammation bronchial tubes, aged people. So if we have old people who are having this complaint of bronchitis, we have a set of medicines given. If we have this complaint of bronchitis in children, so let me tell you, bronchitis is a condition which happens as acute complaint also. So if it is in cases of children and if it is an acute complaint, we have 3 medicines, Dalkamara, Ipecac, Kalikar. Then next we have pleurisy, that is affection of pleura. If this has occurred, okay, so we are running short of time, so just I'll move towards the next slide. Where do we find it into the Kent's repertory? That is chest chapter. We will find inflammation of pleura, and we have a lot of sub rubrics given. So here, according to the pleural side which is affected, we also have different medicines, right, left, inflammation of pleura, neglected, inflammation of pleura, old people in. So nitric acid is a single remedy rubric given. Inflammation pleura, thesical patients in. So thesical is a word used for tuberculosis in old school. Then inflammation of pleura, rheumatic. So we have a few medicines given also as sub rubric. Next is pulmonary tuberculosis. So when we talk of pulmonary tuberculosis, we have again its reference into the Kent's repertory in chest chapter as thesis pulmonalis. So that is pulmonary tuberculosis, which is an old school terminology. And then we have a lot of sub rubrics given again under that. And
Madam, if you don't mind, only 2 minutes are there. So can we
yes,
ask for any question answers if you don't mind?
yes, sir. Just a second. This was the end of my slide. That
Oh,
is
no
chest
problem. It's
chapter.
going very interesting,
Pulmonary.
but we have a time limitation.
Yes, and respiration is also a chapter where we have a lot of, rubrics given by Dr. Kent, different types of respiration. And cough is an important chapter when we talk of observing the patient and clinical rubrics. So I thank you all for giving me this opportunity. And if any one of the respected doctors, if you want to contact me, you can have my email ID given over here.
Okay. Can I request for any question in the chat box? We have our 2 minutes only remaining. Okay, no problem. Yes, madam. Actually, you have very nicely presented this topic today. Kent's repertory is compiled from Dr. Bonning-Hussain and Dr. Herring's work, and also Dr. Kent's clinical work. The repertory is compiled with this. Also, we had learned that there were many limitations in acute and pathological cases, but you rightly highlighted all the pathological conditions of the abdomen. So we are very happy for it. In your last lecture also, I remember decubitus was one of the good rubrics which you highlighted, and now we'll be using it. So with this, we are very happy with your presentation. Hope in future we again would request our IFPH to arrange for one more session. And now can I request for vote of thanks? Dr. Manoj sir, are you free? Yeah. Can we request you?
Yes,
Dr.
I
Manoj,
shall. I shall.
Yes, sir. Sir is impatient. Dinesh
Yes,
sir, can you have a vote of thanks?
Yes, Dr. RATADIYA. It's really a brilliant session. Though
Thank you, sir.
you were running like a 2020 game, so much fast, but things are, that means that you have a lot of things to share. And definitely we can have another session for the same, because this kind of thing is very, very important for homeopathic study. And those who follow this kind of methods definitely will be a winner at practice. And this is what the purpose of the International Forum for Promoting Homeopathy too. We have
Good.
to connect between doctors around the world. We have to educate ourselves, and we have to spread homeopathy to the public also. So
Yes, sir.
Yeah. So like
Sir,
we
I would
thank.
also like to speak a few words.
Yes,
Sir, I am very grateful. I'm very thankful to IFPH and also to Dr. Dhanesh, to Dr. Indranil, because without even knowing each other, this is the only medium through which we
Yeah.
all have connected. And then also you are praising, appreciating whatever I have tried to explain. This is very appreciable, sir. Thank you.
No,
Thank
no,
you all of you.
you're really done well, and we really appreciate your good work, and we expect more lectures from you. So
Yes,
thank
sir.
you, Dr. Dhanesh, for a vote of thanks. And like I request the Malayalam section to take over the charge. Thank you for all attendees also. Thank you, madam. Yeah.
Thank you, sir.